How can we help those that are struggling with drug addictions end the cycle for good? This is the Leaders of Transformation podcast. And on this show, we interview difference makers and world changers who are disrupting for good. Thank you for listening. I'm Nicole Jansen, and our guest today is Christina Dent, who is an advocate and founder of End It for Good. And we're going to talk today about some health-centered alternatives to the criminal justice system and helping people who have drug addictions. And this is in order for them to for us to dramatically reduce crime, overdose deaths, and destabilization of families. So are you ready? A shout out to our friends at Interview Valet. I always like doing a shout out to those who are supporting this show. And they recommended Christina as a guest. Tom and Karen and their whole team are fantastic. And I highly recommend them if you're looking to get on more podcasts. They would be a great option. Interview Valet. So a little plug for them. And we just appreciate them. A lot of the guests that have been on this show have actually been recommended by Interview Valet. So again, thank you for that. And just before we dive into the conversation with Christina, I just want to say that this podcast is actually brought to you by my coaching and training company. And so if you are a leader who wants to be better, do better, and make a greater impact, go to leadersoftrandsformation.com/coaching and book a free consultation with me. It's a 45-minute consultation. We go through your goals, your specific situation, and how you want to make a greater impact, and what it's going to take for you to become the leader that you're capable of being. So I encourage you to do that. And so, yeah, with that, let's just dive right in. Christina, welcome to the Leaders of Transformation. We're excited that you're here today.
Thanks so much for having me, Nicole. It's great to be here.
It is a pleasure, and I'm excited to hear about what you're doing and having you share with our listeners. So let's start off with, how did you get into the place of being an advocate in this area?
Yeah, I have kind of an untraditional journey for that. I live in Mississippi, born and raised here, have lived here my whole life. I grew up in a conservative Christian home. I was homeschooled kindergarten through 12th grade. Never used drugs, never was interested in that. I went to a Christian university. I got a degree in Bible, was not introduced to drug use or anything there either. And really, so for me, this issue of kind of drugs, how do we handle drugs? Like, that was not on my radar at all until we became foster parents. And then through about the next 4 years or so of foster care, I kind of came to see this up close for the first time. Many children who are in foster care are there because of some sort of drug-related removal from their parents. Either their parents are struggling with addiction, or maybe they just tested positive on a drug test, and a judge used that to say, that you're not good parents and we need to remove those children. So through our foster care journey, I met a woman named Joanne, and she had struggled with an addiction for many years, had started using drugs when she was in her early teens, and she was now in her early 30s. And she had not been able to beat that addiction while she was pregnant. And so when her son was born, he was placed in foster care, and he was brought to our house, and we became his foster family. And for me, that was something I didn't understand at all. I couldn't fathom how a mother who loved her son could possibly use drugs while she was pregnant. Who would do that? And so when I brought Beckham to his first visit with Joanne at the local child welfare office, I was totally unprepared for this woman who is sprinting across the parking lot towards me, weeping as she runs over and starts covering Beckham with kisses. This is my first time I've met Joanne. I was very taken aback, very suspicious. No, this doesn't make sense with what I think about people who use drugs, people who would use drugs while they were pregnant. And so Joanne spent her visitation time, or 1 hour, with her son. She left, and she ended up going to an inpatient drug treatment center in North Mississippi. And she would call me from drug treatment, and she would sing to Beckham over the phone. She would say, "Can you put me on speakerphone?" And she would sing to him. And, he's just this 5-pound, 9-ounce little tiny, preemie infant. And I just began to see in her, the more that I got to know her, that this is a mom like me. She loves her son just as much as I love my 3 sons. Her addiction is serious, and it needs to be addressed, but it's not a criminal issue. It's a really complex health crisis, maybe spiritual crisis, maybe lots of other things in there. But I could absolutely see putting Joanne in prison isn't going to fix her addiction, because drugs are readily available in jails and prisons. And it's also going to tear apart this vulnerable family and this mother who wants to raise her child, loves her child, and is also trying to address something that could be a problem in that relationship. And that really, for me, started this war in my heart over, okay, this is Joanne. So now this has kind of been humanized for me in the face of one person that I know. But I know that there's millions of people like Joanne. And I know that we're putting thousands of them in prison every day for the same thing that Joanne is struggling with. Um, and I'm a learner. I love to learn. I love to understand things. That's how I've always been. And I wasn't content to just say, maybe this is, Joanne must be different, because I really could see, okay, if we're doing anything wrong on this, we're doing it wrong on a massive scale. Like the impact of this on people's lives, with how many people are struggling with an addiction, is just massive. And so I went on this journey to learn, and I started reading, and I started talking with people, and ended up realizing, wow, I have really radically misunderstood what is causing harm related to drugs. And because I've misunderstood what's causing the harm, I've been supporting policies that I think now are actually making the harm worse instead of actually making it better. Not just for people like Joanne who are using drugs, but for people like me who aren't using illicit substances. It affects all of us. So I'd love to talk a little more about kind of what I learned on that journey, and then how we're sharing that through the nonprofit that I started with other people on an issue that can be really controversial.
Yeah, absolutely. And what you just talked about indicates the kind of the surface level discovery that you've made through this process. But, along the way, I'm sure this has been transformational to you in how you see not just Joanne and others like her, but just in general. It kind of gives you a different lens of the world. I think about sometimes oftentimes when we go through things ourselves, I think about, like, I'm divorced, right? So before I was divorced, I remember being in my 20s and saying to someone, I would never marry somebody who's divorced, because, I don't want somebody who's already tainted by a previous relationship or whatever. And then, of course, I get married and I marry somebody who is divorced, and I become a divorcee, divorce myself. And so it changed my view on things, and it actually gave me more empathy for the struggle that people go through, just like with health issues or financial issues or whatever it is. I had recently, somebody said, I get you. I get what it's like to be a single person, which I never did before until I was really sick and couldn't take care of myself, and couldn't get out of bed. And so we create this, I don't think God allows any of these things or even wants any of these things to happen in that sense, but he certainly can use those things to deepen our relationship and turn them for good. So I'd love to hear a little bit more about how that has changed your heart overall, maybe even the way you raise your kids. And then we can talk about some of the reforms that you're recommending and what you're doing through End It for Good.
Mm-hmm. Yeah, this journey has been hands down the most humbling journey of my life. It's really difficult to rethink something that you've believed your whole life. And I had supported these kind of tough on drugs, prohibition stance my whole life. And that's not easy for any of us, no matter really what it is, to rethink something that we have voted for, even just kind of ideologically supported. So for me, this journey was one of wanting to say, okay, based on my values, I want to understand how we can help more people. And I think for most people, that is what we want. We want a world that's more thriving. So as I kind of went through this journey, I began to learn about, okay, I tried to kind of zoom out and say, okay, where is drug harm coming from? What are the root causes of this? And began to learn how, when you criminalize a drug market, it doesn't go away, but it does go underground, which means there's lots of crime and violence that come from that, as people can only get a piece of that financial pie if they're willing to take it by force. And so that started me thinking about, wow, all of these people, primarily in inner cities, also south of our border in countries where cartels tend to be more active, in places in the US where gangs tend to be more active. We are creating financial backing for them through this underground drug market, because that's what happens when drugs are not allowed to be sold illegally. I was talking to a man whose mom grew up in Colombia. And when I was talking to him, he leaned forward and he said, do you see the charm on my necklace? And I said, yeah. So it was a little cutout of the country of Colombia, like a little, country charm. And he flipped it over and he said, that inscription on the back is my mom's blood type. When she was a girl growing up in Colombia, there was so much violence related to the underground drug market that the government encouraged citizens to have their blood type either tattooed on their body or on their body in some way, because so many regular civilians were getting caught in just the crossfire of violence from that. Now, that's just, imagine growing up as a girl with that kind of threat of danger hanging over you. And that's not a danger that we have to live with. I mean, there's some level of violence, yes, but what she was growing up in, and what many of us are growing up in, are communities that are actually, they have so much of that crime and violence because of the underground drug market. And it's not there in legal markets like alcohol and tobacco. People aren't shooting each other up over just the sale and production of those things. So I kind of learned about all of this harm and violence that's coming from the prohibition of a legal market for these substances. And then I learned about, particularly prevalent today, our overdose crisis, how many people are dying of drug overdoses. And when you dive into that, what you see is that primarily people are dying from contaminated drugs they bought on the street. They don't know what's in it, so they can't appropriately dose it for their body, how much is actually going to get them high versus how much is going to be too much and going to actually kill them. And so, I took in the news right now is fentanyl. A lot of people are dying from fentanyl overdoses. It's a really potent synthetic opioid that's being used to kind of add into drugs on the street to make them more potent, which makes them easier to smuggle because you have to smuggle a smaller package. And so my youngest son cut his finger. We had to take him to the emergency room to get it stitched. And the nurse came in and she said, oh, here, I've got some fentanyl. It's going to help him feel better. This is my son, who was 4 at the time. Now, why can a nurse in an emergency room give a 4-year-old fentanyl, and it's just a wonderful analgesic that helps him not be in pain while his finger gets stitched up? And yet we have 40-year-old men who are dying from fentanyl overdoses. It's not because fentanyl is in itself bad. It's because in a hospital setting, you can appropriately dose it because they're getting legal fentanyl. And on the street, people are getting who knows what, and they have no idea how strong it is. And they're dying from that because they generally can't get that legally. So we have all of these overdoses being caused by contamination, higher potency from these drugs on the street that people are buying because they're not allowed to buy those drugs in a legal way. And then we have what happens to consumers. I saw this happen firsthand. I was in a courtroom. Someone had asked me to come and be present at their sentencing hearing. This is not something I do regularly. This is the only time I've ever done this. But what happens is you go in and you listen through the cases that come beforehand. Everybody comes at, say, 9:00 in the morning, and then they just go through cases and you sit through until your loved one's case is heard. Well, one of the men whose case came before hers, he came into the courtroom and he was maybe about 20. And the charge was heroin possession. It was his first time ever charged. There was no distribution or anything. He'd never been in trouble with the law before. First arrest, first anything for heroin possession. And he had been in jail already for 4 months because he didn't have enough money to pay the bail amount to get out until his sentencing hearing. And so I went home. He had a really unique name. And I just thought, I wonder who this guy is. He wasn't, this wasn't like assault or anything. He just was caught with a drug that he was illegal, that he wasn't supposed to have. So I went home and I looked him up, found him immediately on Facebook. He was married. He had a toddler daughter at home, was employed. And I just sitting with that and thinking, what are we doing to that young family? Is this helping him? If he's addicted to heroin, is it helping him that he's sitting in jail while his family has potentially lost their only source of income? I don't know if his wife worked or not. His daughter's spending months without her father. There's just an incredible amount of stress on this family. And nobody's really winning here. His drug use isn't being addressed, and his family's being really destabilized by this. And so I started to realize the collateral damage of using the criminal justice system to handle drug use and even the drug market has immense impact on increasing crime, increasing death from overdose, and increasing the destabilization of families, making it even harder for people who are addicted to get the help that's going to help them get better, because we actually know now that trauma increases the risk of addiction. We didn't always know that scientifically. We do know that now. And so it's what crushes me. What has been the hardest part for me is this realization that we are using trauma, the criminal justice system, to try to address a problem that is fundamentally made worse by trauma. It's like throwing gasoline on a house fire. And we continue to wonder, why is this not working? And sadly, there are many millions of people who are being damaged and hurt, some of them dying, not because the criminal justice system isn't the right tool for some things, but just because it's not the right tool for this thing if we want to actually decrease the harms from that. And that journey was hard. It was really difficult for me to kind of go through that process. I felt like at every turn, it was like, oh no, one more thing I didn't know or misunderstood, or this is really difficult to kind of figure out. And I ended up coming to the conclusion that my values stayed the same. I still value the sanctity of life. I still value strong families. I still value safe communities. But I changed my mind about the best way to get those things. The best path forward, not a perfect path, but a realistic, better path forward. And one of the things I learned from that was just the freedom that comes from not having to try to pretend like we know everything, that we don't have anywhere that we can grow, anywhere that we might have blind spots. And I think as leaders, we have to be willing and open to seeing where are our own blind spots. I always tell people, like, the minute I stop learning is the minute you should never listen to anything else that I say, because all of us have areas that we need to grow and learn. And when we're open to that, it can lead to great transformation, and that can lead to really life-giving responses to other people.
Yes, absolutely. And I think of some of our listeners might be listening going, wait a second, are you saying that we should legalize these drugs? What are the solutions? And one of the things you talked about there was, this is not the right solution for this. It might be a right solution for something. What do you think is the solution for how we can handle this issue without negating the issue itself, if that makes sense?
Yeah, it does. So there's a couple of different options for solutions that kind of address different parts of the harm. So one is you can decriminalize possession of substances, where we just don't arrest people for being in possession of a substance anymore. Portugal did this 20 years ago. They also greatly expanded their access to treatment for people who did have an addiction, and they had great results from that. Their injection drug use dropped in half. They have a 1/3 less addiction than they used to, just by kind of stopping that cycle of trauma from putting the same people who are using drugs back in jail over and over again. And instead just meeting them with, if you have a problematic relationship with these substances, do you want help with that? Or can we help you get a job? Can we help you build a life that you want to be fully present for? So maybe these substances don't play such a significant role in your life anymore. So that's one option, is dealing kind of with that consumer piece and not arresting people just for possessing a substance. Now, if you're assaulting someone because you're high, or you're driving drunk, or you're driving high, or whatever, those are totally separate things. And I would say you're putting other people in danger then. And just like with alcohol, we don't let you drive drunk just because alcohol is legal. We still say, nope, you can consume that in your own home, but you can't get on the road if you have been drinking over a certain amount. But then those other pieces of the crime coming from an underground market and the overdoses happening because of contamination, those can really only be addressed through allowing that market to operate in some legal form. So I would say with different drugs, it would be different regulatory models. So if there's a lower potential for harm drug like marijuana, which you can't overdose on, it harms a lot fewer people who use it than some other drugs like heroin might. So you might have a different regulatory model for marijuana that's specific to its potential for harm. And you might have a maybe more tightly regulated model for something like heroin. Other countries have experimented with this for people who are addicted to heroin. They can become part of a program where they can go to a clinic. They can use medical grade heroin on site. They're not allowed to take it home. And they can do that under the care of a doctor. So if they were to overdose, there would be medical care there for them. But typically that doesn't happen because the doctors are helping them to know how much is, going to be too much for them. And what they found is when you allow people to stabilize their lives, even if they're addicted to heroin, they can hold a job, they can parent, they can be present in a lot of different things. And what they have done is said, in order for someone to stop using heroin, they're going to need to replace that with other things, positive things in their life. You can't just empty the cup. You have to fill the cup up with other good things in order for, nobody walks around with an empty cup. We fill it with something. And so they have taken that and said, we're going to try to help people build lives that they want to be fully present for. And we're going to keep them alive long enough to do that. And part of that is getting them off the street where they're not, stealing to get enough money for drugs. They're not engaging in prostitution to get enough money for drugs. They can come to a clinic and we're going to meet them with love and compassion. We're going to help them stabilize their life, even if they're not ready to stop using right now, but they can still be a successful part of society. And over time, what they found is generally people decrease their dose and many of them stop using altogether. But it's a very different way of thinking about it because we tend to put so much emphasis on the drug itself and not on why people are using it. And the reality is people use drugs because they feel something in them. And you can't just take that away. You have to figure out what role is that drug playing in their life. And if we don't want them using that, we need to help fill that with other things that are positive and community building. So I would say, it's hard as a parent. I have 3 sons. My oldest will be 13 in a few weeks. So I think about, on the one hand, what does this mean as a mom who doesn't want her children using drugs? And yet I, started an organization to invite people to consider a legal regulated market for substances as the best path to reducing harm from those substances. But I think about that on the flip side as a mom too. If my sons do experiment, I don't want them being arrested for it. I don't want them dying from an overdose because something they bought was contaminated. And, I don't want them participating in the underground market that can be really dangerous to participate in to get those substances. I would actually rather those drugs be behind a counter than just on a, street corner somewhere, readily available. Right now, I was talking to this one guy and he is in recovery from opioid addiction. He said, when we were in high school, we used to smoke marijuana all afternoon while we drove around trying to find a way to get alcohol. So marijuana was illegal. Alcohol is legal for adults. They had to at least find somebody's older brother who would go buy the alcohol for them because people aren't generally selling alcohol on the underground market. Whereas marijuana is just as readily available for a 14-year-old as it is for a 44-year-old in a state where it's illegal. It's readily available and there's no incentive not to sell to teenagers like there is in legal states. So even in thinking about the safety of my own sons, there is this tension of, it feels like somehow a good tool to have in the toolbox to say, this is illegal. That's why you shouldn't do it. And yet there's a great cost to that. And it could be a great cost to them and to me. And many, many families are realizing that cost as they're either dealing with criminal justice involvement, they're losing a family member to a preventable overdose, or they're living in communities that are racked by the crime from the underground market.
Well, you bring up a really good point here that we've got to look at the cause of why people are using drugs in the first place. They use, it's like you might start off with some alcohol, or you might start off with some marijuana or whatever. And then after a while, it's not enough, right? You don't get the buzz, you don't get the hit if you need it. And so it's the progressive thing that goes on. But when you think about why people do it in the first place, there's a pain that they're experiencing, like you said. And how do we help those as a society? How do we help them heal? And if we were to invest as much money in that, is what I'm hearing you say, than we do in putting them in prison, and the cost, because there's a cost, huge cost for managing our prisons, to be able to reinvest that money into helping them to heal, for at least for those that want it, and then start to reduce the volume, if you will, of people that are being negatively impacted. And maybe you can bring some of them kind of along the way, along the spectrum, and maybe even healing, improving, like you said. Maybe they're not ready to get off of it, but maybe they can reduce it. So you mentioned about Portugal and what they're doing there. Do you have any other examples, and even talk about your organization and how you're advocating specifically for this? I know you do seminars and information sessions with people, and you must get so much resistance when you first introduce this concept in certain circles. I'm sure there would be a lot of resistance. There's a lot of judgment around this, just like there's judgment around other things, depending on the circle and what is socially acceptable in that circle, or what is socially unacceptable in that circle. You'd get a lot of judgment from that. So yeah, a few more examples of maybe what you've experienced, and maybe here on US soil, if you have any stats on like that, and then what your organization is practically doing.
Yeah. So there's a lot of things happening related to changing the way that we approach drugs in the US. So in many states now, marijuana is kind of the first drug that they're looking at. And that's largely because it is the most used illegal drug of any of them by far. Almost 50% of American adults have used marijuana. The next highest would be, I think, cocaine at 16%. So there's a huge drop off between marijuana use and any other illegal drug. Most people who use marijuana illegally don't even ever use any other illegal drugs. So, it's kind of interesting. I've been to states that have legal marijuana. I've never been in a dispensary. I just don't, because I'm not pro marijuana in that sense. I'm not, for drug use at all. I see those as, I can drive past a dispensary in those states and say, that's a symbol that marijuana prohibition here is over, which means there's a lot fewer people being put in prison, certainly for, marijuana charges. The teenagers at least have to have a little bit of a barrier now to get to the marijuana. It's behind a counter that's age restricted. And at least they're going to know what they're using, whether it's adults or youth. They have some idea of the potency, of purity of the substances that they're using. So some of the interesting things that they have found in states that have legalized marijuana. So going back to the parenting, a lot of people are worried about, what is this going to kind of signal to our kids? Is it going to tell them it's okay to use marijuana? And what they found is that in states that have legal marijuana, youth use has not increased. So it doesn't have the effect that people are worried about, that it's kind of be this explosion of youth use. It has not had that impact. What they found is arrests go down, and there really aren't a lot of negative impacts. Adult use does tend to rise sort of over time, but not significantly in a lot of states. And by far the group of people who are most likely to use more once it is legal are people over 65. So that's consistent everywhere, that the age bracket of people. Just a guess would be that there's a lot of, pains and aches and medical conditions that people over 65 have. And the medical use of marijuana for those, instead of using things like opioids or other prescription pharmaceuticals, a lot of people are finding that's preferable to using, more kind of pharmaceutical responses to that. So it's always interesting. I think people think marijuana use and they immediately go to, young people getting stoned at a concert, which certainly happens. But really, if you look at where is the most significant changes, increases in use happening post legalization, it's with elderly people. And it's not with youth at all. That's not going forward. So I would see that as, this is a positive step forward. So so marijuana, it's happening with marijuana. In
How
some
do they
states,
know? I just wanted to jump in there and ask you on that. How do they know that it hasn't gone up? Like, what are they measuring?
It's a good question.
How are they measuring?
Yeah. So they send out surveys. States do it differently. There's also national, groups that do surveys. And so it's kind of an honor system. They're asking parents and youth to fill out surveys on, some of it's related to drug use, some of it's related to other things. And there would be a sense where we might say, well, are they being honest then? It's the honor system. They're not actually testing these kids. But I think logically what we would think might happen is that they would be more likely to admit that they've used it once marijuana is legal for adults. And there's at least less stigmatization of adult use. And yet we don't see that. There isn't a shift in that youth use where it's increasing, even though it's people are self-describing whether or not they're using. But even with the loss of the stigma after adult legalization, we don't see more youth that are willing to, admit that they're using marijuana.
So they did polls before, let's say, and they knew how many were using illegal drugs. Maybe it was anonymous responses and so forth, and or testing how many got overdosed or whatever the case, not with marijuana necessarily, but whoever got arrested, and they can look at those numbers and then they can look at these numbers and then compare the two. Okay.
Yeah. So marijuana, what seems to be coming next is psychedelics, which also have can potentially have medical benefits. There's a lot of research being done on psychedelics like MDMA or psilocybin, which is the kind of active ingredient in mushrooms, psilocybin mushrooms, things being used to treat PTSD, major depression, things like that. And so again, I would say, it's not that I'm like, yes, everyone go out and use psychedelics, but are psychedelics better, legal and regulated, or are they better just kind of this free for all of the underground market? So we kind of invite people to think through that there are more reasons why people would want to end drug prohibition than just because they want to use drugs. There's a whole other set of reasons coming from our perspective of wanting to just see people thriving and realizing the human cost of what we're doing is preventing thriving for millions and millions of people. And we want to rethink whether or not we could actually get more people thriving if we treated drugs as a health issue rather than a criminal justice issue. So we really try to do that through non-judgmental, non-confrontational discussions, dialogue with people. We host these all over Mississippi where we're headquartered. And then we do them, through podcasts like this and just inviting people into this conversation. It could be a really difficult topic for people. What we have found is when you approach people with respect, when you offer to listen, we try to do as many opportunities as possible for people to give feedback when we present in a live environment. And people get a chance to say, I agree, or I totally disagree, and this is why, or these are my questions. People want to talk. They don't want to be yelled at. They don't want to be disrespected. They want to be heard. They want their concerns taken seriously. And that's what we try to do. And we see ourselves as bridge builders, not as warriors. And I think for anyone who is trying to change people's minds or shift cultural norms or anything like that, there's a sense in all of us of sort of wanting to get the sword out. And, I'm just going to make my point. And if you're on social media, this is pretty much all people do now. They just scream at each other. And it just doesn't move anyone in the direction you want them to move in. If anything, it's a net negative because you push them further away because now they're sure that they're never going to agree with anything you're talking about because you've been ugly and disrespectful. So being a warrior on a battlefield is not how you win people. You might be able to slay them that way, but you will not win them that way. And if we want to move people on issues and get more people kind of in our movement, that takes bridge building, which means going to people, meeting them where they are, answering their questions, not the questions you think they might be having, but listening enough to know what they're actually concerned about, and then providing opportunities for them to have those roadblocks removed and respecting them, even if they end up disagreeing. I've got friends and family members who still disagree with where I've landed on drug policy. That's okay. We can be friends. We can love each other. We can hang out. This isn't the only single issue in the world. And it isn't something that we all have to agree about to be able to have civil discourse about it and to be able to come together on other issues. We really want to contribute to a world that is respectful, invitational, and allows people to have the time and space to use their own intellect to think through tough issues. And we want them to just be on that journey with us as long as they're willing to take that journey, no matter where they end up.
Yeah, got it. Well, so I'm going to recommend, this is a good opportunity to mention that you have a TEDx talk. We'll make sure a link to that is in the show notes, as well your website, enditforgood.com, where they can go and learn more. So in terms of joining your movement, how do they do that? And if they're not in Mississippi, how do they get involved, get their local politicians involved? What does that look like? And specifically what we're talking about is not just the legalization, but the solution providing. So the treatments, what you're talking about in Portugal, how do we get some of those things in place so that we're not just legalizing, but that we're actually taking the people that and helping the people that have issues in this area to heal and to be free of it.
Mm-hmm. So I would say there's, you can go to enditforgood.com/get started. And that has just some easy ways to get started, whether you're new to the issue and just need to learn more before you can kind of decide what you think, or whether you kind of want to take the next step and say, hey, how can I actually be part of inviting more people into this conversation? So what happens is policy changes as more people change their minds. So we are on a continual mission to invite more and more people to reconsider what we're doing, because that's the thing that creates a tipping point for policy change. Policies don't change as long as policymakers believe that people don't want them to change. So the first step is helping more people change their minds, which is kind of our primary goal, is to invite people on that journey to consider changing their mind. Whether they do or not is up to them. And then to take that and say, we want to create this kind of public movement that policymakers can see the community is changing their mind about how we want to approach drugs. So depending on where you live, some states are much further along that journey, and advocating with your legislator is going to be a lot more impactful. Some states are not as far along, and really just spreading this invitation to your friends, family, social networks, professional networks, that's the best way that you can move it forward, because maybe your legislators aren't ready to listen yet until more of their constituents are actually talking about it. So kind of depending on where people think their community falls, they may lean more towards trying to educate and invite regular citizens into the conversation. Other people might find it's more impactful to go straight to legislators and invite them into that conversation. But that, I think, is the best thing that we can do, is invite people on a journey to learn, whether they're policymakers or whether they are regular citizens, to just bring them along and invite them to come. You can send them to End It for Good's website. We'd love to have them engage with us on that journey as well. But that's what we want. That's what we try to present more opportunities for. And we also have, if you sign up for our newsletter, we kind of are always doing. We actually just did one earlier today. We did a quarterly training for people that want to kind of learn how to engage more people in this conversation. So we're always trying to kind of walk that tightrope. We never want people to feel like, oh, if you show any interest, we're going to like make you go, call your legislator. And they're like, wait a second, I'm not even sure I agree with what you're doing. So we simultaneously want to provide people a way to learn, but also a way to be engaged in moving the conversation forward. So ways to do both of those at enditforgood.com. And you can follow us on social media at enditforgoodms and at Christina B. Dent is where mine is. So whether you're in Mississippi, if you're in Mississippi, we have live events you can come to. If you're outside of Mississippi, there's other ways that you can engage as well. We'd love to have you wherever you are. We hope this becomes a nationwide movement for compassionate, life-giving care and drug policy that's based on human flourishing.
Amen. Amen. So, well, thank you. Thank you, Christina. I appreciate you. And what I hear is advocacy. So if the people are listening, I believe that leaders of transformation take action. So, if this is something that, if you're listening and it's kind of piqued your interest, whether you disagree or whether you agree and you just want to learn more information, or whether or not you want to get involved, maybe you've had an experience, with it yourself, and you can say, I can relate to Christina's story. I would encourage you go to enditforgood.com, reach out to her. By the way, Christina, is this a nonprofit or is this a for-profit? How is this set up, or is this just strictly informational? How have you set up
We are nonprofit
entity? Nonprofit.
Yep, we're
so
nonprofit.
do you receive donations as well? And okay, so
Yep.
people can also donate to the organization if something that you want to support, and you say, you know what, I'm not the one to call, but I got money
That's
that
right.
I can
Yes.
put towards it, and you guys do what you do best.
Absolutely.
So, awesome. Well, again, as I said, leaders of transformation take action. So take action on something that you heard today. Number one, if this topic interests you and you want to get involved and you want to start sharing it, learn more about it and learn how to share it. Number two way that you can take action on this is think about something that you've experienced, your own personal experience, and think about maybe something you said, you know what, that's not right. I don't agree with that. Or maybe I saw it this way and now I see it this way because of my own experience. And somebody ought to do something about that. I hope that this encourages you and inspires you to be that somebody who decides you're going to take action. Maybe it's talking to a few other people and getting some people together. And so you're not just doing it on your own. But even if you had to do it on your own, if it's something that you truly believe in, it starts taking the steps forward. And maybe it is about connecting with people like Christina and saying, how'd you do it? And there's other people that have been on this show. How did you do it? You had an idea, you wanted to get it started, you didn't know how. And so, I would encourage you to do that, because this is where change happens. It happens on a grassroots level. I love what Christina said. It doesn't happen on the policy level. Policymakers won't make the change until they see there's enough people that have interest. And so it starts with you and me. So I encourage you that. We'd love to hear your stories. Go on leadersoftransformation.com. You can follow us on social as well at Leaders of Transformation, or myself, Nicole, Jansen, Inc. And reach out to us. Let us know what you're doing. We'd love to celebrate you. We'd love to encourage you and help you along the way if you need some support along the way. And mentorship and all of that is available as well. So we encourage you that. Thank you for being here, and we look forward to seeing you in the next episode of Leaders of Transformation real soon.